So for starters, I don't want to put words in either of your mouths, and I think I would love to sort of clear the air and make sure everybody in our audience knows where you all stand on sort of the three big issues that guide the women's health debate. And that is your stance on abortion, your position on whether the state should subsidize family planning, and what role you think Planned Parenthood plays in any and all of this. So we can just start off with, for starters, your stance on abortion. Yours is probably going to be predictable, but let's go, tell me where you are on this.
Well, I think the common terminology is pro-choice, but what I like to think of is pro-responsibility, that this is about having policies in place that allow women to responsibly manage their own health care, that allow policies to be put into place that result in responsible government and healthy families.
Well, I'm certainly not pro-death. I am somewhat uncomfortable with the labels of being you have to be either pro-choice or pro-life. I admire those that think it's such a black and white issue. For me, it is not. Personally, I cannot imagine undergoing an abortion. But I know that I wouldn't want anyone making that decision for me, and I don't feel comfortable making that decision for all women.
Great. And then, part two, your position on whether the state should subsidize family planning, which was a huge debate in the last legislative session.
I was actually kind of surprised by that. I know that abortion's been the big issue for a long time with some folks, but the fact that we were actually debating whether or not birth control and contraceptives should be a part of the equation really took me aback. Certainly, there are personal choices, personal responsibilities at play here, but the simple practical reality is that if the government does not help subsidize access to health care, including contraceptive health care, for women who could not afford it otherwise, then we certainly will pay much more in the long run with unintended pregnancies and the consequences of that. So I just think it makes practical sense to look at what we need to do to make sure that women, no matter what their income level, have access to reproductive health care.
Representative Davis, where do you come down on this, and what were your votes like in the last session with regards to those budget cuts?
There were many votes that we took that were transferring money out of family planning and into other, quite frankly, very important programs for autistic children or for the state school for the deaf and blind. And you remember making those votes. And you are really put in a position, because both programs, quite frankly, I think are very important. I think access to contraception and family planning for the poorest among us in the state is a priority because it's a fiscally conservative policy. We save millions of dollars when we have these access in place. But when you're forced to make a choice between sending money to help those with children of autism or sending money for free contraception, I made the decision to send most of those votes to other priorities in the budget. Now, I did not vote consistently to move all of the family planning cuts. There were some proposals that I voted against because I didn't think that there was an actual medical, any medical care being provided by those programs.
So when you looked at that trade-off, some of those programs in your mind were more important or more valuable than funding reproductive health or family planning?
Yes.
Okay.
May I say something
Yep.
about that? I mean, the fact that we were even put in the position of making those choices and taking those votes, I think demonstrated, though, the fact that there were a group of people who had an agenda to try to decimate our family planning program, because the Appropriations Committee had presented cuts to all kinds of programs across the state, and they presented an 11% cut to family planning. By the end of that day, we had cut it by, not we, I didn't vote for it, it had been cut by 2/3. That was unprecedented in terms of anything else in the budget. So, you know, the fact that we were even put in that position, I think, clearly demonstrates the the extreme agenda effort among some people to really prevent women having access to health care.
Well, what were, Representative Davis, as a Republican, you know, what were the backroom conversations going on around those cuts? I mean, I know you didn't support all of them, but to see, I think, a $73 million cut, you know, moderate Republicans were saying this is a budget decision. You know, you had Tea Party Republicans and on the far right saying, no, we are defunding the abortion industry in Texas. You know, what were the conversations going on in caucus meetings or behind the scenes?
Well, being the lone Republican to vote against the sonogram bill, I was not a part of a lot of these discussions. So I can't really comment. In caucus, this was not something that I recall we ever discussed specifically about family planning. It came a surprise to me that we were being forced to make all of these votes.
And what kind of position did that put you in? I mean, you mentioned that you were the lone Republican to vote against the sonogram bill. What kind of position did those votes, those types of votes, put you in with your party?
Well, for the most part, I voted along party lines for the cuts, so that didn't spark any controversy.
Moving into sort of the third tenet, which is what role Planned Parenthood should play, again, in providing reproductive health care for women in Texas, but primarily in the state's subsidized programs. I'm curious where both of you come down on how big of a role they have or have not played, and what their role should be going forward.
Well, clearly they've had a huge role to play. If you look at the women's health program in particular, the Medicaid program, Planned Parenthood, I think, represents maybe 2% of the providers, but actually serves almost half of the clients that participate in that program. So it's a huge player. It's they've provided access to women throughout the state who know what they offer, who can go there, who can get the services they need. The vast majority of the services provided by Planned Parenthood are preventive health care for women. You know, this whole concept of defunding Planned Parenthood to get at abortion, not one penny of state dollars goes to abortion. There is a firewall between the preventive health care services that Planned Parenthood provides and the abortion service, which I want to remind people is a legal medical procedure. So they have a huge role to play here, and to cut them out of the state subsidized programs, it's a huge hit on women's access to care.
I mean, talk about that firewall a little bit, because whether there is or is not a firewall is often sort of the crux of this debate, and how can you be sure that money that's coming in the door, federal or state dollars for one service, is not helping to keep an organization afloat. Explain to me how that works, or why anyone should believe that exists.
For one thing, there are audits, and to my knowledge, there's not been any problem in the audits that's been discovered. So there is a separation of the operations, there's a separation of the funding. The audits have confirmed that. With the Medicaid program, Planned Parenthood, as well as any other clinic, is being reimbursed for particular services. Those services are provided, they're reimbursed at a reduced rate. This is not subsidizing anything. This is providing the service and paying for the service. So there's no fungibility here. There's nothing that's happening to the provision of the abortions. And in fact, all the cuts that are being made are affecting preventive health care. Nothing's affecting the abortion care. That's still ongoing. That is still being funded separately. So it is not even affecting that, other than creating the possibility for more abortions by depriving women access to contraceptives.
But I think from a perspective from the right, any dollar that goes into Planned Parenthood that is from taxpayers for whatever the services are, frees up money for them to perform abortions. I'm not trying to say that that's a position that I advocate, but that is the perspective that I hear from those on the right.
Well, what do you advocate then with regards to Planned Parenthood in particular?
Well, I think it's become quite clear to me that we do not currently have the providers in place to take up where Planned Parenthood has been, and that to me is the focus, that we have got to find enough providers. And knowing that Planned Parenthood, and I believe I think it's 40% of all of the participants in the women's health program were getting their services from Planned Parenthood, the fact that we have not been able to adequately come up with the appropriate level of providers, I think makes the role of Planned Parenthood even more important.
Right, so this has been, we're talking a little bit about the Women's Health Program as sort of the direction we've moved, and part of the sort of controversy around the Women's Health Program that you all have been hearing is whether this new Texas-run program, we've foregone the federal state joint program, which was providing a 9-to-1 federal match, largely because the state had the goal of ensuring that abortion providers or affiliates of abortion providers were not participating in this program. So, and I know that we have HHSC Commissioner Janik in the audience. A lot of the conversation has been around whether HHSC and whether this program does have the providers without Planned Parenthood. So let's move into that. I know that I've seen some press releases from some Democrats in the legislature saying, we've been making cold calls to the providers on the state's list, that they're not providing or accepting new clients. What have you all heard? Where are you in your conversations around whether this program is going to work without Planned Parenthood?
Well, we have been working with HHSC to try to get the information to ensure that the data that we have is accurate, and I know that they're continuing to work on it, but my confidence is not really great at this point in time, in that initially a lot of the data that was on the website indicated duplicate providers who did not actually plan the direct services to women. When my office called, plugging in zip codes from Austin, we would go through numbers of the providers before we would get to anyone that said, yes, we actually take women's health program clients. In addition to that, the recent data that came out to support the list that they had, which I have to say also they've removed that provider list from the website right now while they supposedly clean it up. But the data to support it, that they based the numbers of the capacity of providers on, also has some errors in it. There's my own particular physician whom I contacted had indicated that he could provide half the capacity at most that was reported in the data. There was a clinic in San Antonio that was going to jump from something like 40 clients to 20,000 some odd clients. I mean, huge numbers. How in the world can you say that's going to happen in a clinic that has, whatever it is, 3 to 7 physicians in it at most? They told us that they had been given information by HHSC that indicated it could kind of be ballparked, and then had been given some suggestions by HHSC. I don't know how this is happening, but when I hear those stories, when I call my own physician and find out what's going on, it indicates that the numbers may not be exactly what they seem, and certainly we have been saying we have a shortage of physicians, a shortage of nurses, declining participation in Medicaid by physicians because of reimbursement rates. It makes no logical sense that all of a sudden we would have an overcapacity of providers. I don't get it. It doesn't make sense.
Now, HHSC has said that they performed an internal survey of many providers, particularly in regions where there was formerly a Planned Parenthood clinic that was participating in the program. They came back with results that showed that there were only 2 parts of the state where they thought they might have an issue capacity-wise, but that everywhere else they felt like the program was robust. Have you had any conversations with HHSC? What have you heard as far as that's concerned?
I have had conversations with HHSC, and that's exactly what I've been told. And I choose not to think that there is anything nefarious going on. I believe that they're working as hard as they possibly can to find the providers that are necessary, if they exist, without Planned Parenthood. But I did want to take issue with one of the first things that you said, which was that Texas chose to forego the federal matching dollars with the affiliate ban. But this is a pilot program, and the Obama administration could have still sent the money because it's solely up to the discretion of Subsidize. So the federal government chose not to send the money because of the affiliate ban, but that wasn't necessarily a requirement.
Well, you're an attorney. The federal government, the Obama administration, said that the state's affiliate ban violated the Social Security Act and that they could not comply because it was a violation of federal law. As an attorney, are they making that up?
Well, the affiliate ban was passed not only last session in Senate Bill 7, but the session before. And we still continue to receive the federal matching dollars.
Right, but the state was not enforcing.
Obviously it wasn't being enforced.
I mean, the state passed the affiliate ban, and then the state, internal lawyers that looked at it at the state thought that maybe it wasn't constitutional, and so they didn't enforce it until the following year with a different makeup of the legislature that said, really, we want Planned Parenthood out. So I think, in your opinion, I guess legally speaking, is the state on solid ground? Would the state have been on solid ground? Would the federal government have been on solid ground to say, fine, we're going to keep funding this?
Well, it's up to the courts, and so far the courts have said that in fact Texas can ban providers. And so therefore, because the courts have upheld what the legislature has done with the affiliate ban, I see no reason why Sibilia shouldn't continue to send the matching dollars.
Let's jump back. We started talking about the family planning cuts the last session and then sort of merged into the women's health program, but I want to go back and talk about those cuts. A $73 million cut, a cut of 2/3 to state family planning funding. In the aftermath, the numbers appear to be pretty staggering. I know HHSC released some figures showing that they're anticipating roughly 24,000 unexpected or unplanned pregnancies in the 2014-2015 biennium at a cost to taxpayers of upwards of $273 million. Have those numbers changed anyone's mind on the right? I mean, are fiscal conservatives looking at this and thinking, geez, we have this giant snowball coming straight down the hill?
You would have to ask them. I would say that those numbers, well, the Legislative Budget Board presented numbers during the appropriations process showing the incredible savings that the Women's Health Program gave to Texas, and it made absolutely no difference when it came down to it in transferring money out of family planning. So I would love to say yes, and as a fiscal conservative, I think that that's very important, that given what happened last session, I do not anticipate a change in the thinking on that subject. But I could be wrong. You would need to talk to other Republicans.
Well, are you playing any role in trying to guide other Republicans to change their views on that subject?
I try to have as many conversations about the subject as I can, yes.
Well, certainly, I do think from some of my conversations with our colleagues, especially Republican colleagues, is that they were a little taken aback when they realized that this not only defunded Planned Parenthood, the cuts that were made to the family planning program, but also resulted in the closure of clinics that had nothing to do with Planned Parenthood, had never been associated with abortion in any way, and yet were forced to close their doors because of these cuts. So I am hearing from some that they're willing to look at this. I'm hoping that we will at least be able to restore some of the funding. My concern, of course, as someone who thinks that we should have every qualified provider be a part of this, is that still means Planned Parenthood is not going to be allowed to participate. But at the same time, I am looking for any options possible to get some of these monies restored, because these are real women who are going to suffer real consequences, not to mention the fiscal conservative part of it that means that the state taxpayer is going to be paying millions more.
Well, let's talk about whether you all feel that there's common ground on this particular issue. I mean, we largely now have Planned Parenthood out of any state-subsidized care, correct? They're not receiving family planning dollars. Title 10, Title 9, or Title 20.
10 and 20.
Ridiculous numbers of titles, but they're not receiving any state or federal dollars through family planning, and they're no longer participating in the women's health program. The courts have so far said upheld that. So, with Planned Parenthood out, then, is the door open to restoring any of these funding cuts? Or are we still looking at a situation where any funding for family planning is not, acceptable to most conservatives?
I think the term family planning and women's health has almost become a four-letter word in conservative circles. But I agree with Donna that when people go home to their districts and they see the impact that it has on their communities, they certainly have to think about more than just being on the floor and who's going to challenge me in my next primary, but what is this going to do for my constituents. And so I do hope that we are going to be able to find some common ground and restoring some of the cuts that were made to family planning.
Have you been having conversations as a Democrat? I mean, you and I have spoken a little bit about, an effort that may be afoot, a bipartisan effort that may be afoot to try to restore some, if not all, of those funds.
Yes, we are having those conversations, and there's a lot of confusion around all of this. For one, because we're talking about two different programs, and we get mixed up about what means what here when we're having those discussions. And I think, again, people did not understand the extent of the cuts that were going to be put into place and how that would impact faith-based clinics and community clinics. And in their own particular communities, especially those that are rural and have less access, that they may not have providers anywhere within a reasonable radius in which a woman could travel to get the services. I don't know how much people understood that this money was specifically going to preventive health care, that none of it was going to abortion. I still hear people have erroneous understandings of that and believe that we're somehow funding abortion, which the state is not. As I said, not one penny goes to abortion. Those who are claiming that they want to reduce abortion, which I think is just about everybody, I don't think anybody wants to see that increase, and in fact it has been decreasing. This unfortunately could reverse that trend, and people need to look really carefully. I hope our colleagues will look really carefully this time at the increased numbers of pregnancies that will be happening that were not intended, and what the cost will be to the state. I will be incredulous if I see my colleagues look at that and turn a blind eye to restoring those funds.
As well, I was recently invited to be a part of the Women's Health Caucus, which I had no idea existed. I'm a second-term legislator, so last session I had no idea that there was even such a caucus. But this year I get extended an invitation, so I'm very much looking forward to seeing the makeup of that caucus, and hopefully there are more Republican women that are asked and that do join the caucus. And I think that would be a good place to start to try and build a foundation for a movement to restore the cuts.
Do you feel like you are out on a limb alone in your party in the legislature, or do you feel like there are people who quietly agree with you but feel like they can't, step out on a limb because they're worried about a primary challenge? I mean, in your conversations with your colleagues, do you feel like there's a lot of wiggle room, or are you pretty far out there?
I don't consider myself pretty far out there. I think that there are plenty of my colleagues that are silently somewhat in agreement with me on some issues.
And why are they silent?
They have their own reasons. I would assume it's fear of a primary challenge. I would assume it's because they are not representative of their district if they were to make those votes. I happen to have, every legislator says their district is unique, and I think my district is the most unique in the state, and the best. But the votes that I take, that I believe in, and I believe represent the values of my district, are not necessarily the same votes that other Republican legislators can take based on their constituents. So even if they believe, inside it pained them to make those family planning cuts, they answer to the people that voted them in office. And if their constituents say, we've got to get rid of all this money in family planning, that's the way they're going to vote.
Let's talk in our last few minutes here about the abortion legislation we can expect to see this session. We've already heard some conversations from Governor Perry about a so-called fetal pain bill that would ban abortion after 20 weeks, or effectively shorten the window for abortions by 7 weeks in Texas. We've heard about a measure that would require doctors to be present to administer the 2 prescription drugs used to induce abortions in the first 7 weeks, while the FDA does say currently that the doctor only should be present for the first one of those 2 drugs. Do you think there is the motivation in this makeup of the legislature to pass measures like that? What are you expecting to see, from both of your parties in the coming weeks and months?
Wow. Well, of course, I'm extremely hopeful that we won't go down that path. We have a Speaker of the House who's at least said, we need to focus on the real issues facing Texans right now, which have to do with water, which have to do with infrastructure and education. This is not an issue. This is really a non-issue. It's a solution in search of a problem. The fact is that the vast majority of our abortions that occur are in the first trimester. This is really not an issue. So when we're looking at the kinds of things that look at late-term abortion, when we're looking at the kinds of things that diminish access to a legal medical procedure, that's certainly appealing to a minority but vocal part of the electorate who have a lot of sway with our leadership. And, quite frankly, I think Governor Perry has used this for political advantage. And, I'm hopeful that those of us in the legislature will be more reasoned about this. We'll recognize that this is not an issue that the majority of Texans want us to be focused on. We have much more serious issues to be dealing with right now. This is a legal procedure. It's between a woman and her physician. The legislature should not be practicing medicine.
And while I completely agree that the legislature should not be practicing medicine, these issues win Republican offices. You had 101 supermajority last session, and I guarantee you a great deal of them were campaigning on the sonogram bill because it was a question on our primary ballot. So to say that those issues are just purely political, that they may be political, but they're also important to a conservative state like Texas. So I don't think we can ignore that. Now you brought up two possible, and I'm not entirely sure if they've been filed, the fetal pain bill. My understanding of Roe v. Wade is a viability analysis, and when I have been talking to doctors, it seems viability is anywhere between 23 and 25 weeks. So I don't necessarily know that that bill is constitutional, but I think we need to look at the science behind it. And I'd rather hear from the medical community than male legislators about it. And so I think that is an issue that we obviously, I'm sensitive to. I was recently in the Valley and visiting a women's hospital and saw a baby that was born at 21 weeks. And she had 10 fingers and 10 toes and was breathing. And that had an impact on me when we're talking about what it means to be viable. But I don't know necessarily that it's constitutional under Roe v. Wade, and I don't know enough about the science to be able to say, this is a bad idea or this is a good idea. The other bill that's being discussed about the second, the administration of the second medicine, as I appreciate it, the administration of the first medication terminates the pregnancy. So missing the second dose does nothing to stop that pregnancy. So it seems to me, like you said, it's a solution where there's no real problem, and in fact, you're probably endangering women by making them return if they live 80 miles away from the clinic and they don't go back. I think that they could actually suffer from some severe health ramifications, and the FDA doesn't require it. So I think that is something that is really aimed at almost just shaming women.
But federal oversight has never stopped Texas before,
Of course not.
obviously.
Of course not.
Wonderful.